Hi guys, I'm Amy with Occupational Therapy. This is my patient Riley, and we are going to be going over the Sarmiento Brace. And Sarmiento braces are for humerus fractures, ordered by Ortho, who then gets it from Burton Prosthetics. And this brace is non-operative, conservative treatment to healing a humerus fracture with the use of the brace to immobilize, and then gravity to help push the fracture back into place eventually over time. So Riley was on those Lime scooters and fell, and she got a humerus fracture. So we are going to be going over dressing and how to put the Sarmiento brace on and off properly. So this brace, so it'd be her right humerus fracture, and you want to slip this in kind of out of her side, and it kind of twists around to the back. And then with that, this top brace comes to the side, and then there is Velcro strapping here, which is kind of strong. And then there's these secure straps here, and then you kind of snug it tight, and then back through to where the Velcro is right here. And then you do the same thing down here. So come around, put the brace on the strap, and then you put it back on itself, like that. And then this comes across the chest of the body, around. And then there's this where you secure it through here. And then there's Velcro behind here. And you want it kind of snug. I'll say, Riley, does that feel okay?
Mm-hmm.
Okay. And that's the Sarmiento brace. So with cleaning the brace, because they might get kind of dirty or smelly, just with our natural oils. So you want to take the brace off, clean the inside with like a sandy wipe, dry it off with a towel. And then if the patient is showering and they want to get into the shower, you would take the brace off once you're in the shower and they're seated safely. Take the brace off, and then when they're showering, they can kind of have their arm at their side and then kind of wash their armpits, things like that. They would then dry off, put the brace back on, and then get out of the shower. The other part of this is the cuff and collar, depending on your patient's pain. So this is a separate order from Burton, and this comes around their wrist, and this helps support their extremities, so they have a little bit more support. And then this comes off, and then around her neck like a necklace. And then you pull down, and then, whoops, you want the arm supported like that. So this is called the cuff and collar. This is separate from the Sarmiento brace. A lot of patients like this for support, so their arm isn't just hanging. Another aspect of this brace is when they're laying down in bed or in the chair, you don't want to put pillows underneath their arm or their elbow, because that kind of defeats the purpose of having gravity push it down in the brace. So having a pillow kind of hikes up the shoulder, so we want their arm to kind of fall in place naturally.